Hi, welcome back. In this video, we will understand about breastfeeding in twin babies, how mothers will breastfeed her babies if she has twins or triplets. So it's very important to understand, especially by the mother, that her breast milk is very important for her baby. Now, is breast milk of mothers with multiple babies enough to feed their babies? That is the question number one. Second is there any difference in the hormone that is responsible for milk production, that is the prolactin secretion in these mothers? And third is, why is it considered that breastfeeding is difficult in mothers with multiple babies or twins or triplets? So here we can see a baby, twins babies fed directly breastfed by the mother. And we have to understand that yes, these mothers will have enough milk to feed both babies or even three babies, because the prolactin hormone, the hormone which is responsible for the milk production in twin mothers, is actually double. And thirdly, why is it difficult? Because these mothers may have C-section. So C-section mothers may have difficulty in breast milk production. There may be prematurity. So preterm babies will have difficulty in directly breastfeeding because their suck, swallow, and the breathing coordination may not be there. Their sucking may be less powerful, and they may have other problems also with prematurity. So twins are more likely to be born preterm, and they may have breathing difficulty and other issues. So how do we address these problems? Now we have to understand that premature babies are the twin pregnancy are likely to end up as prematurity. So the suck potential may vary in between different babies, especially those born with prematurity. So we need to advise the mother to give direct breastfeed followed by spoon feeding on demand. So she can express her breast milk and then give by spoon feeding. So expression can be done by using hand as well as the breast pump, and the breast pump may be manual and electrical. For expressing, she has to wash her hands, and she has to sterilize the feeding utensils as well as the pump using soap and water, and then wash with warm water, and then submerge the utensil and pump under boiling water for at least 15 minutes. And in these babies, we usually monitor the blood sugar. And blood sugars are monitored at 1 hour after birth, then 3 hours after birth, and then 6 hours, and then every 6 hourly. Especially in babies who are preterm, that means the gestation age is less than 37 weeks, or weight is less than 2.5 or 2.6 or 2.7. And sometimes larger babies may also have low blood sugar. So babies whose weight is more than 3.6 kilo are also they are monitored for low blood sugar. And babies of diabetic mother as well as babies who are having infection, those babies also we monitor the blood sugar. Now, if the blood sugar is less than 55, then the doctor or the physician is informed, and the blood sugars are monitored more closely, maybe every 2 hourly, and then gradually tapered. The monitoring blood sugar check is done every 4th hourly, and then reduced to every 6 hourly if the blood sugars are more than 55 milligram per deciliter. However, if the blood sugars are less than 45 milligram per deciliter, which is considered very low, then in those cases, the direct breastfeed followed by spoon feeding is given immediately with the mother's milk, and the blood sugars are checked after 1 hour and thereafter very closely. Now, if the blood sugar level of the baby is less than 45 milligram per deciliter twice, or if the blood sugar is very low, less than 25 milligram per deciliter, or if the baby has symptoms of low blood sugar like seizure, or if there is oral feeding is not tolerated along with low blood sugar, then the baby is given IV fluid, 10% dextrose, initially as a small bolus and then maintain it with continued IV fluid. So this is what we do for preterm as well as small weight multiple twins also. So as in twin babies, as the baby sucks more and more milk is produced, more prolactin hormone is secreted in the mother's body, and hence a mother with multiple babies, twins and triplets will have more milk. If one or more babies are unable to suck enough, then mother can express the milk and give by spoon feeding or palatal feeding. Now, how do we feed twins? We can feed preferably by alternate breast. So both twins have to be fed on both sides. That the feeding, so that the milk output becomes balanced on both sides. Now, the more vigorous twin will stimulate the letdown reflex in the other breast. So they have to be fed simultaneously on alternate breast, or they can be fed separately as well on alternate breast. So this is the double football hold position. So as you know, in football hold position, the babies are held like a football under the axilla of the mother, and the neck is supported by the hand of the same side. So this is a double football. So both babies are held and fed together. Now there is another position, double cradle hold position, where the mother supports the baby's neck by her elbow or by her forearm, and the both babies are fed together. So this is the double football position. Then there you can mother can feed the twins baby by a football and a cradle position. So one baby is held in a cradle position, the other baby is held in a football hold position. So these are the various positions used by mothers to feed their twins. So double cradle position or front cross position, double football position, football and cradle position, and even upright latch position. Now, when does the twin baby's mothers usually have problems in breast milk supply? It has been seen that as the baby grows and as the baby requires more milk, and the mother may go into stress, and around by second month, they may have trouble in having enough milk production. So these mothers need to be called at around 2 months, and they need to be advised and supported and encouraged by telling the mothers to express the milk by using hand or breast pump, and also breastfeed as early as possible and as long as possible. So if there is any trouble for the babies to feed directly, maybe because of nose block, you can open the nose with saline nasal drops, and you can stimulate the baby if the baby is sleepy while feeding. And after feeding, you can take the baby on your shoulder to remove the gas. So feed as long as possible, and feed simultaneously if possible by double football position. Feed as frequently as possible. So even at night, the mother has to feed at least 4 to 5 times in 24 hours in the night, because it is in the night time that the prolactin hormone, the hormone responsible for milk production, is secreted more. And she should sleep with the baby. So especially during daytime, initially, in the first 3 months, the babies wake up at night, so she can sleep during daytime so that she can feed at least 4 to 5 times at night. She should take adequate amount of water, so at least 2 glasses of water at a time, like that, total of 8 to 10 or 10 to 12 glasses as per her requirement. Then she should have homemade food and control any pain. If she has back pain, she can get her back massaged by her own relatives at least 4 times or 3 to 4 times for 10 to 15 minutes duration on both sides of the back, using the thumb in a circular and straight fashion. And she should have adequate self-belief, confidence, and you should motivate her and encourage her. And she should, if she is worried, overthinking, she should do pattern interruption techniques to get out of the overthinking and tension, and calm her mind, and add more self-belief so that she will have enough milk. And she can use galactose. These are medicines which are supposed to increase the milk production, and she can do kangaroo mother care, maybe simultaneous kangaroo mother care. So with that, I hope you understood how to increase milk and maintain the milk in mothers with twins babies or triplet babies. Thank you.